I'd like to begin by welcoming you to The Therapy Show, a podcast series that seeks to explain the leading forms of psychological therapy to the average person. We will be doing this by interviewing the professionals who develop those therapies so that we can better understand when to use them and how to get the most from therapy. Today, I'm honored to welcome Dr. Judith McCoyd. Dr. McCoyd is an associate professor at Rutgers School of Social Work and co-author of Grief and Loss Across the Lifespan, a book that seeks to educate mental health clinicians on how to address the needs of someone experiencing grief and loss. Dr. McCoyd, welcome to The Therapy Show.
Thank you. Look forward to talking with you.
Can you start by telling us a little bit about your personal background and professional development that led you to your work in grief and loss therapy?
Sure. I think, like most people, I've certainly had loss in my life, as do pretty much all humans. And so that had intrigued me early on when I was working on my master's in social work in the 80s. And one of the things that I found particularly intriguing in terms of having it interact with the health social work that I was doing in hospitals at the time was the way that people thought that loss was only about death. And I was seeing lots of other sorts of loss during that time. And so by the time I decided to pursue my PhD, I made perinatal loss the sort of fulcrum of my dissertation work, looking at how loss plays out. And that was actually about a death loss, about a perinatal loss, how it plays out when there's not much support for the experience of loss. So that really is the kind of personal and scholarly direction of my work came into being because I kept finding that the only thing that people talked about was Kubler-Ross, and I did not find that all that useful for the kind of work that I was doing with women who had had a pregnancy loss, which was the particular area of my work when I was still in hospitals in the 80s and 90s. And so that really is what spurred me to then be much more interested in grief and loss as a scholarly area of work as well as a therapeutic area of work. And I'll tell you a little bit more about that as we go along.
So how would you explain grief and loss therapy to a non-professional?
I think I would start by talking about the fact that much of grief and loss therapeutic technique had been steeped in Kubler-Ross's 5 stages. It was certainly into the 70s and even the early 80s. There are still people that think that is the way to think about it. But the bottom line is that it never really, the idea of stages never really worked because by definition, stage theory, people should walk through those stages kind of invariably. And from a social work perspective, which is the kind of mental health clinician that I am, it really is not culturally competent to think that there's any set of stages that apply to all people in all times with no context. And so grief and loss therapy, as I understand it, and as the way I would explain it to a non-professional, would be therapy that's directed to help people process loss, but that draws on many more concepts such as meaning making, whether you take that from Viktor Frankl or whether you take that from Robert Niemeyer, who's the person who utilizes meaning making in grief theory at this point in time, or whether you think about the changes that came along in the 90s, particularly around continuing bonds and this idea that we're not looking in grief and loss therapy to try and get people to some ridiculous, if you ask me, approach of acceptance or closure. Instead, we're looking to help people develop a continuing bond that they can maintain with whoever or whatever was lost in ways that help them continue to make meaning in their life and move forward in their life. And I think that that's really what grief and loss therapy is about, is helping people begin to think about how the loss impacted their life and how they move forward from that loss.
When and how did you realize that grief and loss would be an effective form of therapeutic intervention?
I kind of think that I grew up thinking that grief and loss therapy could be useful. Most humans have an experience of loss that affects them deeply and find that they benefit from having somebody to talk with about it. And I don't know that as a youngster or even as a teenager that I thought about therapy as such, but as I moved into a career that was very much about therapeutic technique, it seemed obvious to me that people benefit by having informed people to talk with about grief and loss, and that these losses could be everything from something that would be understood as loss pretty across the board, like a death loss, but it also included things like losing a job or losing a romantic relationship or losing an identity that one might pursue. So for me in college, I had been a pre-med, and actually the academics of that all came together fairly well for me, but I decided that lifestyle was not for me. And so I switched to medical social work from pursuing medicine. And that loss was one that was not viewed as a loss. And yet I very much was experiencing it as a loss. And so at that point, I kept thinking, what would be really helpful is to have somebody to talk with about this. And so that in some ways that was part of the beginning of my focus on grief and loss. Like, let's look at the losses that people don't recognize as losses and what would be helpful to people in those situations. I also was very involved career-wise at that point with people who had pregnancy losses. And so again, I was trying out these different ways of thinking about working with people after a loss. And so I think that grief and loss therapy is not its own special approach, though it certainly has its own special theories that guide it. But essentially, I think the effective form of therapeutic intervention in terms of grief and loss is having somebody who is informed by postmodern grief theory and is able to reflect on and process losses that people experience, whether they're death losses or other types of losses. And so I think that realization came as a result of some of my own, what I would now understand as disenfranchised losses.
And can you explain a little bit more about complicated grief?
Sure. Complicated grief as a diagnosis is not just a type of grief that has complications related to it. Catherine Shear and actually Holly Prigerson are both known for developing the concept of complicated grief. Catherine Shear is about complicated grief using that title, and Holly Prigerson uses the terminology of prolonged grief. But in both cases, this is a type of grief that it is qualitatively different from a more typical grief reaction that we expect to take, a year to 2 years for the most intense parts of it, and up to 10 years for the longer parts of it, the ongoing processing. But for complicated grief, it maintains for over a year a sense of extreme yearning for the person or thing that was lost, usually a person in complicated grief. It has both the quality of being longer than is typical, as well as this quality of yearningness to it. And that's really the tendency toward not just yearning, but having sort of flashbacks almost to the loss event is another piece of complicated grief. Now, that did not end up making the DSM-5, but it is there as a diagnosis to be pursued. And I would just say that grief and loss therapy is not just for people who have had some sort of clinical diagnosis like complicated grief. And it's not even for just people who have grief and loss that has complications, which is different from complicated grief. But it really, ideally, grief and loss therapy would be available for people almost like wellness programs are for healthy people, that grief and loss treatment would be available for people who are going through the transition of some sort of loss.
Who is grief and loss therapy most effective for?
As sort of implied before, I think that grief and loss therapy can be effective for anybody who is consciously trying to process a change in their life that they're not happy about. Because loss is not just about losing something or some person. Loss can also be about losing the state of the way one's life was. And so I believe that basically grief and loss therapy is effective for anybody who is going through a transition that may not be what they want it to be. And so grief and loss therapy can work to help that person process that transition, think about what their life story is as a result of that transition. And that makes it very effective for a very broad group of people. So I would say it's probably effective for anybody going through any life transition.
What's the average length of treatment for somebody working with a grief and loss therapist?
I'd like to be able to give an answer to that is informed by research, and I can't do that. I don't know that there's an average length of treatment. I know that for people who are doing the kind of the more manualized approach to complicated grief, those treatments get done within 3 to 4 months. And my experience of working in my clinical practice is that most people, if it's a sort of straightforward experience of grief and loss, they're generally done between 3 and 6 months. There are sometimes that people come back at the year anniversary of a major loss to sort of do booster sessions, but generally people can do a lot of that processing for 3 to 6 months and be done.
What skills, habits, or tactics can clients and therapists adopt, either during their sessions or in between sessions, to improve the effectiveness of their treatment with a grief and loss therapist?
So I'm going to focus mostly on what the clients can do, because they're kind of different things between sessions. But for clients, one of the things that we're often doing as grief therapists is encouraging those clients to maybe write letters to their, if it's a deceased, if the loss is about a deceased loved one, write letters as they reflect, or do some sort of creative artwork. I've seen people do everything from collages to rap lyrics, but something that's creative, because one of the things that often happens after a major loss is that there's a sense of sort of deadness. And in doing some sort of creative art or creative storytelling or even letter writing, there's a way that people begin to reflect on and process their loss in ways that is useful and then becomes part of the work that they bring in when we have client sessions. And certainly the therapist obviously is setting homework for people to do that kind of work between sessions so that there's a movement and a momentum that gets going, because grief and loss almost always incorporates some degree of sadness, if not true depressive symptomatology, which, as we know, deactivates people, kind of immobilizes them. And so one of the things that the grief and loss therapist is doing in conjunction with the client is to try and help them stay mobilized and reflecting actively on the loss so that they can keep moving through it.
What are the most common obstacles or missteps that prevent therapists and clients alike from seeing the full benefits of treatment with a grief and loss therapist?
I think the biggest obstacle, and I wouldn't even call it a misstep necessarily, but the biggest obstacle to processing grief and loss is anger. Maybe there's a death that people are angry at the doctor or some other person, or it's the end of a relationship and the person is really stuck in their anger at that person who's left them or something. Anger has this tendency to really derail the work that grief and loss therapy is set to do. So if you think about grief and loss therapy almost as a form of narrative therapy, where you're working to kind of create the new life story and understand the new life story, and also do the meaning making and continuing bonds work that is part of that, the anger just keeps one from being able to move into thinking about one's own life and what the loss means in one's own life. So that really cuts off any sort of meaning making. It cuts off what we think of as dual process, that kind of dipping into loss and dipping into restoration and moving back and forth between those, because the person isn't ready to think about restoration. They're really stuck in their anger. And so the biggest obstacle to grief and loss is that anger. We have to process that before we can get to processing the grief and loss. I think another misstep or obstacle is the idea that there is one way to do grief and loss. And I think that that's why, in my mind, Kubler-Ross was phenomenal. She was way ahead of her time in terms of being open to thinking about death and dying. But her stages were meant for people who were dying. They were not meant for people who were grieving. And so one of the missteps that I see happen quite often is that grievers think they're supposed to go through these stages. And I've had more, clients turn up in my office saying, I'm at anger and I want to be at acceptance. And that gets in the way, right? Because it makes it as if there is a way of doing it, and that reflecting on one's own life and thinking about what the lost entity means to the person, they don't necessarily see that as part of grief and loss. And so that becomes, again, a misstep or an obstacle when people are trying to push themselves to experience certain stages. There is also the set of task theories that are more widely, adopted, approved in some grief and loss circles. And those tasks are, again, sort of prescribed tasks that people are to walk through, and they have a little bit more salience in my mind. But that's not the type of grief and loss therapy that I adhere to, because, again, I find that people need to be able to do it in ways that are culturally appropriate for them, that I have to learn from them, and if they have cultures that are different from my own, that they need to have very idiosyncratic and tailored grief and loss therapy course that meets their needs, rather than trying to push them through a set of tasks or certainly stages. So again, I think those are the most common obstacles that I see, that whether it's the anger that people bring sometimes that gets in the way, or whether it's the misstep of thinking that there are stages that one is supposed to go through.
Can you share any poignant examples where working within the grief and loss framework had a major impact in someone's life? Of course, without giving away any identifying information.
I have so many clients that I feel like all of their stories are special to me, and so I feel like they're all poignant. But I think I'll do sort of a composite, because I work quite frequently with women who have had to terminate a pregnancy after the finding of a fetal anomaly. And these are women and couples who have desperately wanted to have that pregnancy come to term. They wanted that baby and they were looking forward to that baby. And then they received a diagnosis during their pregnancy that baby had some major problem. And so they have, in terms of this composite client, though I've had multiple clients like this, they've had to end the pregnancy. The termination is called an abortion, and so that is something that they live with. And the poignancy of people who are feeling so judged by others and so stigmatized by the procedure they had to go through, while still grieving desperately and missing desperately the baby that they had already created in their mind. That is a very special and poignant type of work. And I feel privileged to have worked with many women, actually, who come in just absolutely devastated, hating themselves, and yet grieving and feeling like they weren't entitled to their grief. And so a big piece of grief and loss work is helping people recognize and validate that they have every right to grieve. And so working with multiple women and couples around how to think about and create their life story in a way that holds the fact that they had to make a heartbreaking decision, and yet they also did what was for them the wise decision, or the only decision that they felt they could make to try and preserve or to save their family and that baby from suffering. And so in the end, that the success comes when they're able to think about, this is part of my life story. This baby is a baby that I can have a continuing bond with, even though that baby will never come to a life here on earth, but that baby still was important to them. And so the poignancy comes in helping them make that movement from often just, having some real negative feelings about themselves and the decision they had to make, but coming to be able to transition that to being able to hold that baby in their heart and maintain the continuing bond with that baby, and move on to their future to have, to fulfill the goal that they had, which was to build their family and to go on and have a healthy baby. And I can't tell you how many families I've worked with like that. And it's, it feels to me like having had a major impact as we help move women and couples from this time of devastation to a time where they can move forward with their lives in ways that are productive for them.
That's incredible. So who is grief and loss not appropriate for?
That's a stumper. Because I actually have a sense that most counseling, when people come to a counselor of any sort, whether that's a clinical social worker or a psychologist or a licensed practical counselor, they're coming because they're upset about something. And almost always, at least through my lens, that's almost always about some sort of transition in their life where they're losing the way their life had been. And so in many ways, I kind of think that most grief and loss, or I guess most counseling, involves grief and loss therapy, even though people don't necessarily view it as grief and loss therapy. It's hard for me to say who it's not appropriate for, because if people are presenting for the kinds of transitions that they come into counseling for, it's often going to be useful to them. It's obviously not appropriate for people with severe mental illness. It's not really appropriate for people who have real concrete needs. You might be doing grief and loss therapy alongside meeting the concrete needs that they might have. But beyond those kind of outliers, I would think that grief and loss therapy, because it's a lot like narrative therapy, has a lot of application in their few categories other than severe mental illness, where I would identify it as not appropriate.
What are you most excited about in mental health treatment today?
That's an interesting question. I guess I think I'm most excited about the fact that we're not trying to necessarily always push people into categories. Certainly in grief and loss work, we are not pushing people into categories of diagnosis, at least more generally. I'm excited about the fact that mental health treatment is trying to find ways to show its effectiveness and its validity, while not saying that it's one way for all people in all times. I think I am very much steeped in the social work ethos that we all have so many different pieces of our cultural identity. That intersectionality idea is very much something I'm excited about in terms of mental health treatment, because we don't say, oh, this person fits this diagnostic category, therefore they should have that kind of treatment, and it's like applied to people. I am excited about the fact that we are doing what we've always said that we should do, which is tailoring treatment to the person, their cultural context, their set of challenges, whether we call those diagnostic or not. And so the idea that we are, I think, living what we preach a little better in terms of recognizing people's unique identities and tailoring treatment to meet what their needs are is one of the most positive improvements in mental health treatment today that I see.
If you had a magic wand and could improve one thing about mental health treatment today, what would that be?
I think a big thing for me would be to try and remove the stigma. We still have very little compensation or help with paying for mental health treatment of various sorts. We still stigmatize it pretty readily, and people sort of look askance at people when they go to a mental health counselor of some sort. And if I had a magic wand, I'd remove all of that and get it less stigmatized so that people would be able to go to a counselor for things that are life transitions as a form of wellness work, rather than just only going when things have gotten so severe that they are really struggling remarkably. And so that magic wand would, if we could remove stigma, I think people would be much more willing to use counseling in its various forms to maintain their mental health and improve their mental health rather than only going when there's some sort of major crisis. So yeah, my magic wand would remove stigma.
That's great. I agree with you 100%. How can my audience learn more about grief and loss therapy, either online or in print?
Well, there are lots of books beside my own, and grief has been addressed for quite a long time in pretty reasonable ways. I would encourage people to look at the work of Kenneth Doka, D-O-K-A, the work of Robert Niemeyer, the work of Therese Rondeau, my own work. All of that is out there in print. Online, there are a variety of support websites for people going through various forms of grief. Loss websites for many different types of loss, losses due to suicide, losses due to stillbirth or miscarriage, losses in the opioid epidemic. There are lots of online support resources out there. I think what I would encourage people to do is if they're going to an online resource, we all know that there are lots of bad online resources as well. And so if you start seeing, you're going to go through these stages, that's a website to kind of move away from. And if you see that it's providing a bit more room for individualized experiences of grief and loss, support resources that are saying, take care of yourself, make sure that you're getting good sleep, make sure that you're eating well, make sure that you're getting the chance to reflect on what the lost entity means to you. Those are probably reasonably good online resources.
So Dr. McCoyd, on behalf of myself, my listeners, and all of the people that you've helped through your work, I want to thank you for your contributions to mental health treatment and for taking time out of your busy schedule to help me and my audience better understand the fields of grief and loss therapy.
Well, I've enjoyed doing it. Some real, some thought-provoking questions, and I enjoyed being with you and your audience.
I'd like to close by reminding our listeners to please subscribe, share, and review this podcast so that you, someone you love, and people around the world can benefit more from therapy. There is no need to suffer in silence. Get the help that you need to create the life that you want.